Good evening, everyone. A warm welcome to the Conduit.
It's great to see our efforts recognized by a BBC mini documentary that we're about to see very shortly, and of course the conversation that we're going to have with our wonderful panelists.
Operation Smile is a global nonprofit that provides free cleft care around the world in 36 countries. We've been doing this for 40 plus years and served tens of thousands of patients. I became involved with Operation Smile and AI because my long-term dream is to bring more programs worldwide to a lot of countries who need it and to build local capacity. In places like Rwanda, where there is a shortage of cleft professionals, leveraging AI allows us to bring the expertise of hundreds or maybe thousands of cleft professionals to that location. For every patient that we take care of at Operation Smile, we take before and after pictures of them. We do tens of thousands of these pictures every year, and that's the data we use to train the AI system. The AI is used for our after photos to help us determine the quality of our results. This is extremely important as we want to provide the gold standard of quality for all patients. It also helps us identify surgeons who can become educators for us.
Good evening, everyone, and a very warm welcome to you all. You've just seen her in the film, and we're lucky to have her here in London tonight, is Dr. Caroline Yao, plastic surgeon, renowned for her work in cleft care and reconstructive surgery with Operation Smile, plus a ton of other accolades I wish I had time to reel off. Next up is Ricardo Martin, Managing Director of Johnson & Johnson MedTech UK and Ireland. He has worked across Europe, Africa, and Turkey, driving innovation at the intersection of biology and technology. And last but not least, it's such a pleasure to have Golda Fania Kamara with us. Golda is a powerful voice in global health and a digital transformation strategist who's worked across Africa, UK, and Nordics to strengthen health systems and champion innovation.
AI, just like any other technology, is based on the people making the algorithms and the data that we use to make the algorithm. And I do think that's a bit that's lost on people. They think that the algorithms somehow have created themselves, or they, go on unfettered, but it really is who is designing it for what purpose, and was there equity in the data that we used. And the history of equity within medical research is fairly poor. Even now, for clinical research, almost 80% of data being put in is for white men. So data like that we're trying to change as we make projects like what you saw in our documentary, by being more inclusive and being just cognizant of that fact that we would like to include a diverse set of people and diverse set of information, means that we are making algorithms that will be hopefully much less biased, or I dream of bias-free, as we look at very rare diseases like cleft lip.
Really this evolution from mission to actually a systemic approach to be able to try and generate self-sustaining, decentralized healthcare.
When you don't include the community that you so-called want to help from the inception of the project, what ends up happening is that of course they're not going to have a buy-in, and of course it's not going to be sustainable.
So the surgical gap is a real thing. I think it's 5 billion people in the world don't have safe access to surgery. It means that something as simple as, hurting your knee playing football, or falling from a tree and breaking your shoulder can be a life-debilitating event. I was very fortunate to get to go to Madagascar as a volunteer to one of these missions. It fills you with like a purpose to try and do something about it. So technology certainly has a role, but it's not the solution to everything.
When we went to the hospitals, they told us about how their workday was. I mean, it was, you come down and you have this fancy PhD, and then they're still dealing with paper, scheduling. It was really amazing, because there's so much information that we get here in the West that we think is the norm, which who decides what is the norm? Like, why do we have monopoly on that? So when we're really looking to make an impact, I think the best thing we could do is actually go with an open mind and an open heart to say, what are you guys actually doing? What results have you already achieved? Because there's a lot of research that doesn't leave some of these countries, again, because of the way which research is accepted in journals and which is not. And then how can we now bridge that gap between capital in the West and then knowledge in the global South?
Making the tech is actually the easy part. You know, I think that part you can do from anywhere. You can make phone calls. You can work with really smart experts from anywhere in the world, and they're excited to do that work. But then the 90% of it is when you're on the ground finding the answers and finding why people don't like it, why won't they use it, why is this adding work to their day and not doing quite what you thought. And if you can work those parts out, you'll be successful. And part of our experience with Operation Smile is in the last 5 to 10 years, we have started to make repositories of patient information. And it's along the project of harnessing that diverse data set, but each country has different needs. Each country has different conventions of how they notate information, different languages, and those conventions really add up because we're trying to make 35 countries do one global data set. And in the last year, we've actually created a World Cleft Consortium doing exactly that, because in the past, there have been 2 large data sets of cleft patients, and they're called AmeriCleft and EuroCleft. So you can imagine the diversity in that, which is very little. And our dream is to make that type of data set, but globally, and then you have all the challenges of each convention in each country and each, even town within one country differ. So that has involved hundreds of volunteers and employees all coming together. Someone from a different country may come and learn. The healthcare providers in the country will show what the challenges are, and we've started this World Cleft Consortium data collection about 6 months ago.
This evening has shown us what's possible when we consider what it would take for innovation in global healthcare to have a tangible impact. Moreover, how we can make sure the future of healthcare is built with and not just for the communities who need it the most. And that each of us can use our influence, however small, to make innovation more inclusive. And that we don't need a genie, because I think the possibility is already here in this room. At least I've really enjoyed hearing your insights this evening. Golda, Ricardo, Caroline, thank you so much. You've been absolutely phenomenal. Let's hear it for our 3 fantastic speakers.